So my name is Julia Grabsa. I'm the editor for JACC Case Reports, and I would like to welcome Dr. Valentin Fuster, who is Physician-in-Chief at Mount Sinai Medical Center in New York, and also the Editor-in-Chief for JACC. Dr. Fuster, thank you for this webinar podcast.
Well, it's a pleasure. It's a difficult time. I am between home and the hospital, between the hospital and home. Today I am home.
So we celebrate, in between this pandemic, but we celebrate 1 year of JACC Case Reports. It's been a great time this year. I would like to start from thanking you for your trust to deliver this huge work. And my first question is, how come you chose me? For example, when you saw me applying for this position, what did you think?
Well, there were 5 contenders, all very, very strong. I capture a number of things. First of all, I think it's important to have an international representation in JACC for something so important. Second, you already had experience, a significant experience in Europe in working in this particular capacity. And third, you have what can I say? You have a tremendous background. And altogether, it became very clear that you were the person.
And you're happy with me?
What can I say? You're doing a fantastic job, I must say. Sometimes I think I would be able to do what she's doing. Anyway, it's fantastic. I think what is interesting, though, going back to the history, is that I have not been a great fan of cases. In fact, I have always worked from the very beginning of my career in developing concepts from a research point of view, and then follow a trace of these concepts. I started with platelets, then I went to imaging, and then to health, all one thing after the other, but all following a track. So I was never interested in cases. However, I attend all the meetings that we have in our hospitals, first in Edinburgh, then in Mayo Clinic, then in Mass General, and then now in Mount Sinai. I attend all the case presentations because I enjoy very much so, but not for a journal. So when somebody came to me about 2 years ago and saying, JACC should have JACC cases, case reports, and I said, I'm not entirely sure. So I gave a thought about it. And then somebody told me the life has changed since you were thinking not about cases many years ago, what it is today. And I was really convinced, and now I am fully convinced, what's happening is the young people particularly like cases, and they like to listen to things rather than reading. and it's a change. So I have, this is why I started the podcasts, for example, for the main JACC. I have done all of them since I started. It's a new way of doing things. And I think what you have demonstrated over the last year is that really success by going into cases. You have made this happen. You have motivated young people.
Thank you for your kind words. Do you remember your first case report, or it was a research paper?
Well, I remember my first case report, in fact, was in a meeting. I was very interested in complex disease, for example, congenital heart disease. And yes, I remember with Dr. Somerville really questioning me, Jane Somerville, where Jane Somerville took care of my talks, what I should say, what I should not say, and Walter Somerville took care of my English. So I still remember those days. I was a very good friend of them. The first case I think I presented in London, and was the issue what to do with atrial septal defect and Eisenmenger syndrome. And in fact, the paper was written afterwards and was very interesting. This was with a case presentation, and then I presented, I think, were about 50 cases that we had with AST and Eisenmenger syndrome. And the first case really was a woman, but then ended up that 80% of the cases with ASD and Eisenmenger were women, something that we see also in primary pulmonary hypertension. There's some relationship there, but that's how I started. But I don't remember presenting a case anymore afterwards in any meeting except in our local meetings.
Perfect. And within JACC case reports, do you think that we have done a good job in matters of diversity and topics, material, different article types?
Yeah, well, I think you have moved into three main arenas, I think, and it's very nicely. I think first is the one we are discussing, the case reports as the role they play in education. And I don't have any question about it. We have a case or two case reports almost every day in Mount Sinai, and I attend most of them. And his role is very, very motivating and trigger of thinking. So you have achieved that, and that is the case reports as a tool for education. I think the other thing I notice is that you're really focusing on young people. Yes, all ages are there, but I know you're geared towards the young and the fellows, the students, and young physicians, young cardiologists. There's no question you're actually accomplishing this, and I know that because we have a record of downloads actually in the journal, and we know who is clicking, who is not, and we have a very good feeling. You're really reaching young people, people of all ages, but particularly young people. What I am most impressed, and I have to put brakes on you, is how you move. You move so dynamically that every week you have a new idea for the journal. And I would say to you, all the ideas are great because you are giving to the journal something young people love it. It's a dynamic approach. You have an echo, you have an MRI here, and on top, then you go to the anatomy, and then you do all these things. And I think this is great. This is real, and it's very attractive. The only question is, if I have to say one thing, you have to put a stop somewhere because it's already so dynamic and so good. Don't try to do new things. Just wait 3 years,
Yeah.
and then you go to with what you have today is amazing. We talk a lot in the American College of Cardiology among us. What are you doing? And I don't know how you are doing it, but the fact of the matter is, I think you should have a rest now. Have what you move on into what you have, and not try to have new adventures at this moment because the journal is fantastic.
Perfect. Thank you. Yes, I want now to have consistency more than anything.
Yeah, this is what I'm talking. Consistency, I think, is very, very important, and because then you become reliable, you become very trusted. Everybody knows where you are, and rather than changing too rapidly. What you have done in a year is a miracle, and I think I would stay there now for a while.
Thank you. And we have discussed so many times from the beginning when I started, you are my mentor. We are discussing over the phone. What is the advice that you would give to people like me?
Well, first of all, mentorship is so important. My life has been actually the result of mentorship. People have told me what to do, what not to do. First of all, mentorship means you need to have a chemistry. You come from Greece, I come from Spain. In a way, I think characterologically speaking, there is a chemistry there already, just culturally. This is very important, very, very important. You need to have a sense of what the person you're dealing with. So this is number one. Number two, I think it's very important, and we had a discussion this morning with my colleagues at Mount Sinai. They said to me the following. They said, with the new fellows coming in now in July, we are going to put a mentor in each of them just to make research a success. And I said, let me tell you something. This is the last thing I would do. Mentorship comes naturally. Mentorship doesn't come, I choose this person for the sake of it. It doesn't. I think that what I'm really saying to you is has to be a chemistry. Maybe there are people you knew in the past and now you want them to come back to you, whatever it is. The second thing is the mentee who really has to be the driving force, not the mentor. The mentee is the one asking questions. I do this well, I don't do this well, and so forth. And just tell me this, tell me that. This is critical because many people think, I want a mentee, and then you expect the mentee to be calling you every other day for something new. It doesn't happen, I can tell you. It doesn't go in this way. It's your job, and then asking. And then what is very important are two things. One by part of the mentee, and the other by part of the mentor. Of part of the mentee is to learn to listen and to accept comments that are not glorious. I mean, I learned much more from what I did poorly. And a mentor told me that somebody saying you are fantastic. I can tell you that. If I go back to my years of research and clinical and so forth, I always remember, never forget where I made the mistakes and who told me how to change them. This is the real mentor, and this is what I'm talking. Something is the mentee to accept negative comments, and part of the mentor is really to be able to say, yes, you're doing very well, and this is why I feel very proud to work with you, but I wouldn't do this, I wouldn't do that, I wouldn't do this, I wouldn't do that. In other words, it has to be a very, very honest, natural exchange. And you know what? This is the most difficult part. I have to tell you, the most difficult part is to establish a relationship between the mentor and the mentee that is quite natural and quite real, not superficial. So when you go into the reality of the world today and the young people, in my experience in dealing with many, many fellows over the years, I actually was the director of the training program in this country for actually 6 years. My conclusion is the young people don't like anybody else to tell them what to do. When they achieve a level that is high enough to say, I made it as a fellow, I made it in a great institution, then they are in their own. I will tell you, huge mistake. In fact, let me tell you, older I get, more mentors I need, because life gets much more complicated. So I think the concept that you achieve something and you don't need anybody else. In fact, I feel completely the opposite. I constantly search for advice, constantly. Why? Because I'm in a big, in thousand things I'm involved with, and I want to be sure that I don't do the wrong things. So I'm just giving you a summary of what the importance of mentorship and the importance for people to accept that all of us should be mentored. And older we get, more than we need it.
That's correct, yeah. And I'm really grateful because you have told me many times, to check about myself or to check the work environment. So it helped me also develop myself as a human being. This year has been a tremendous change for me, first as Julia, and then of course as an editor to deliver the work that you trusted me. And I'm really grateful because we've been through this transition, we've been through a lot of discussions, and I'm really grateful for all your comments as a mentor.
Yeah, well, it's amazing what you have done in a year is amazing, but now comes the moment, stop, as I told you.
Yes.
Now, surveillance and sustainability that we call, and this is a great success. I would never have thought 6 years ago when I took over the journal, JACC, that we would have a journal and case reports. So in a way, I feel very happy I'm getting younger.
You are young, so if you're getting even younger, that's great. So the last question, of course, was that I believe that sky is the limit, but I feel now it's all about consistency and to make sure we keep all stages of training and also junior together with senior colleagues all together like a big family.
I agree with you. I think we are all working together in the family. We're very well integrated, but I think you are absolutely correct. Just don't go more and more and more. To reach the sky is unlimited, but please just limit yourself and get into the 7th floor of your building. Stay there. Don't go any higher. Stay there.
Yes. Thank you. Any questions for me or
No, I mean, the questions for you, more than questions, I would say to you that I know you were talking a minute ago about a human being. You're a real human being. I know that. And I want to be sure you have enough time in your life to not to think about JACC. This is my only advice. It's not even a question. It's an advice from somebody who I worked very hard, but at least I think that I was able to prioritize things, and certainly, you know, your friends, your family, and so forth. Don't forget, you worked very, very hard, and maybe this is the last comment I would like to give to you today as a mentor. Be sure that that part of the life is really fulfilling you as much as JACC, or even more.
You told me this from the first day that I met you, and always you keep asking me if I'm having rest, if I have time for me. So I appreciate that. I'm really grateful.
Well, it's important. Well, thank you very much, and
Thank
congratulations
you.
for this first year. Maybe we'll have another one of these next year.
Definitely,
All right.
yes. Thank you so much. Thank you.
Pleasure. Nice to see you, and it has been wonderful experience to work with you for the last year. Thank
Same.
you.
Thank you.
Thank you.